Osteotomy surgery is quite painful afterwards. Most people have quite a swollen knee and can have a swollen leg from the bruising, and this can slow them down in the first 2 to 3 weeks. Most people have some pain for that first 2 to 3 weeks, but that's manageable with painkillers and keeping the leg elevated and iced, etc.
Swelling is your key objective, basically. Everybody will get swelling after their operation. You need to spend some time to make sure that your leg recovers and settles down. So elevation has a massive part to play. Don't expect to get back to your normal activities immediately.
It didn't recover as quickly as I would like, and it took, I guess, about 2 months before I was really, the pain was right down below the level it had been before.
For an osteotomy, we'd be expecting them to initially to rest, because that is the most important thing, to get the swelling down, to let the effects of the surgery subside, and reduce the swelling, particularly in the knee and the lower leg. But at the same time as resting and elevating the leg using ice packs, keeping the thigh muscles going, getting the knee bend back again, maintaining the circulation.
They would see a physiotherapist every week or two for that first few weeks to guide them through that rehabilitation. And you'll see your surgeon generally at the 6-week mark, where you'll be looking to come off your crutches. We do some x-rays to check the alignment we've achieved and check the thing's healing. And patients continue to have physiotherapy until they deem that they don't need it anymore.
After the first 2 weeks, once the initial swelling has settled and once they've had the stitches out and the wounds checked, then we'd be aiming to get them up and actually full weight bearing, because full weight bearing with the osteotomy is the most important thing to promote healing, and then increasing the muscle strength and gradually getting them off the crutches, with the aim of being off crutches really at about 6 to 8 weeks.
There are patients that want to come off their crutches as early as 3-4 weeks. Most keep them, at least as a precaution, until 6 weeks. The knee won't feel normal at 6 weeks. It will still be quite sore from the surgery, although with the modern fixation plates we find that the patient feels confident with the knee, and as I said, many patients walk in holding their crutches at the 6-week appointment.
Normal's a funny word, isn't it? And normal is about what's normal for them and what they want to achieve. So we're aiming all the time for their highest possible level of activity that they are capable of achieving.
Most osteotomy patients have much less pain and much better function 6 months after their surgery. We can look at very complex scoring systems to achieve this, and obviously some patients are good and some aren't so good. But if we look at our averages, and we do this with our Hampshire Hospitals database, the scores achieved are very similar to that of partial knee joint replacement, which is said to be the gold standard of sort of joint replacement in the knee. So they're not back to someone who's normal, who's never had a problem with their knee, but they're much better than they were before the surgery.
After an osteotomy, you should get back to most normal levels of activity. But is it going to turn the clock back 20 years and allow you to play the football that you were playing 20 years ago? Probably not. But it will hopefully make your knee feel a hell of a lot more comfortable than it was before the operation.
Full recovery really comes at about 3 to 6 months. Okay, so I mean, 3 to 6 months sounds like a very broad range, but these are patients with very individual problems in their knees. The operations are very individual to them, and therefore their progress, it's very difficult to really generalise about their progress, but they make significant progress after 3 months, and then they're really progressing up through 6 months and really up to a year probably for some of them.
Many patients can ski, play tennis, and there are some that run, although that wouldn't be the typical patient. So really back to normal. They're much improved to what they were before, but this isn't a normal knee, and it never will be quite a normal knee. There may be some aches and pains, and if they overload it and do some crazy sports or whatever, they may find that there's still some pain.
Find out more about the post-operative physio and exercise programme in the exercise playlists of the site.